Cancer. Nearly 10 million people die from cancer every year. According to the World Health Organization, the number of people who will die from cancer by 2030 will be multiplied by 2, making the cancer a major reason of death. Unfortunately, most of the cancer patients are diagnosed at advanced stages of disease progression, when the conventional treatment provides no significant effect. My own grandmother was diagnosed with stage 4 lung cancer in 2013, and she sadly passed away a year later, after being heavily treated with chemo and radiation therapy. Sadly, back in the days, the immunotherapy was not yet available. But today, immunotherapy can significantly increase the survival and prognosis for lung cancer patients. These drugs are able to boost the proliferation of specific immune cells known as T lymphocytes, which will further attack and destroy malignant tumor. However, in almost half of the patients, the increased activation of those T lymphocytes is commonly associated with specific side effects known as immune-related toxicity. This toxicity is supposed to be T-cell driven, and it is an autoimmune inflammation which can occur in multiple organs and tissues, resulting in immunotherapy discontinuation. And cancer is a smart disease. Once the immunotherapy is stopped, there are no barriers for it to grow again. Thus, immunotherapy is a double-edged sword, which can be a magical cure for half of the patients, but at the same time, another half of the patients will experience severe and sometimes even deadly autoimmune reactions. So my PhD aims to establish an algorithm for predicting those undesirable side effects at pre-treatment stage. This algorithm will be based on genetic signatures of T lymphocytes, which are unique for the patients with toxicity. It is a multi-collaborative study which implements cutting-edge spatial analysis and single-cell sequencing on blood and tissue samples collected from clinical trial patients across Sydney. The preliminary data has already suggested that the human leukocyte antigen genes are significantly overexpressed in patients with toxicity. And with the support provided by Bristol Myers Squibb, we are now able to further elucidate the established genetic signatures in a large cohort of 130 patients. And if validated successfully, it may outline a new milestone for the personalized approach in cancer immunotherapy, by making immunotherapy not just effective, but safe for each eligible cancer patient. And finally, I hope that in future, every grandchild will be able to enjoy their childhood with their grandparents, whom they love so much. Thank you.